Today is International Day of Medical Physics, and it's about appreciating our colleagues who work in medical physics across all centres in the UK. Hi, my name is Richard and I'm a trainee clinical scientist.
And my name's Evan Marshall and I'm also a trainee clinical scientist working here at Velindre Cancer Centre.
So medical physics is split into 4 sections. There's treatment planning, there's dosimetry, there's brachytherapy and there's computing. Treatment planning is about the personalised creation of a radiotherapy treatment plan, which will tell the LINAC where to target the treatment. Dosimetry is all about machine commissioning, it's about quality assurance.
A really good example of what a clinical scientist might do is testing the linear accelerators using dose detecting equipment to make sure that the doses that we're delivering to the patient are as we expect.
Brachytherapy is a specialised form of radiotherapy where a radioactive source is placed close to a tumour, and then computing, they control and maintain all of the various computer systems that the sections need in order to function. I would say I highly recommend a career in medical physics. If you're a bit of a science nerd and you want to use that to help people, then I'd highly recommend it. This is a career for you.
I'm Kirsty. I work as a trainee clinical scientist here in nuclear medicine at Velindre Cancer Centre. Nuclear medicine is a fascinating field where we use unsealed radioactive sources to treat and diagnose cancers. Typically, we would perform either diagnostic or therapeutic treatments, so this involves administering radioactivity to patients. I really enjoy that we're making such a difference to patient outcomes. We have had funding from the JCC. We're going to be bringing PRT therapy to patients in Wales. By getting this funding, we are going to be able to repatriate patients so that they can be treated more locally.
My name's Laura Boyd and I'm a trainee clinical scientist in radiation protection and diagnostic imaging. In radiation protection, we use sound scientific principles and expert advice to support those working with and exposed to ionising radiation at every point in the clinical care pathway. We have intimate and expert knowledge of international and national legislation for the safe use of ionising radiation, and we ensure that the employer enacts best practice to maintain the safety of patients, staff and public. The Radiation Protection Service are a team that provide regional and national support for over half the Welsh population. So we're quite varied in our roles, so we might get things that come in more urgently that need to be dealt with. This could be like a patient dose estimate, or it could be a CT tube has blown in one of the hospitals. So we have to be quite flexible in what we do. Honestly, the team that I work with is what I love the most about my job. They're so supportive, so encouraging. The managers as well, they always want to facilitate us in what our dreams and aspirations are.